Good day. Here up in the north, we've been having a lot of snowstorms and ice storms, and people have been expressing their concern with back pain and tight hips. So today we're going to spend a little extra time in the first half of the session doing preparatory work for those purposes. So we'll start out with the massage ball and do a bit of soft tissue work first. Okay, so we're just working on the pecs. And, if you're feeling a bit tighter, then you might press around, like right around the breast and just below, like along the breastbone. You can go quite thoroughly into the pectoral muscles here. And let your head be away from the ball direction and angle a bit down. So there's been a lot of, snow yesterday. We had close to a foot of snow again. And then, just walking in that kind of terrain. Next week, we'll do more extensive work for the feet and ankles. But today, we'll pay extra attention to tight hips. And if you happen to be in a southern climate, this is perfect training session. And I would call it foundational work for gardening. Okay, others for side here, chest. You might bring that arm up. When you get here at the underarm, you can lift the arm up like this. All right, and next, feet. A part of the back discomforts come from just bending over, lifting things up without proper support from the hips. And next on your foot, if you can press into the ball in the forefoot, and then in other parts of your foot that are maybe feeling thicker and harder, just press down. That's the way. But another component of back pain, switch feet, is rotation. So when we're like shoveling stone, you're rotating like that. If you're constantly rotating in one direction, then you over rotate the vertebrae relative to each other, and that will squeeze the nerve root. And then that's where we get back pain as well. So one factor is just bending over, not lifting up correctly. Another is the turning component. And then just press down a bit here. And then reaching up, trying to get the snow off the car, or reaching up into the trees, picking the oranges, harvesting the oranges. The neck angle and the shoulder blade actions today will focus on that component of movement. Yeah, just press into the forefoot. Okay. So we'll go on the floor and just do a bit of massage work for the hips and the upper trapezius muscles. So you'll just need the massage ball, and we'll be using a strap for hamstrings and a broomstick for alignment and a foam roller for the quads. If you happen to have this also on the floor, we're going to use, this is a towel. You see, it's just a bath towel rolled up. And I have this big medicine ball. You may not have one, a beach ball or a basketball would be fine, but that's not necessary if you don't have those. Okay, so we'll start. The upper trapezius is like right here at the base of the neck, just above the shoulder area. We're just going to take a moment. And I like to start on the left side. I would say most commonly, I see high left shoulders amongst the population. And the left arm up. And depending on how it's feeling today, So right at the base of your neck, I like to go right across the base of the neck. So it's cross fiber of the tendons of the upper trapezius and the levator scapula muscles. And then on the belly of the muscle, so sometimes you might just press into it, or you might move side to side across. And some days you'll feel strings or like a cable. Some days it might feel quite relaxed. Definitely around here after yesterday, everybody's really sore up here. And this winter we've had a lot of snowstorms, so bodies are responding. Okay, so next, the ball a little further to the side. Now you're working at the edge of the shoulder blade. And if you can bring the arm up, it gets the shoulder blade out of the way so you can get to the tissues that are underneath between the shoulder blade and the ribs. And that muscle is called the subscapularis muscle. Okay, and then we'll work on the right side. So again, it's at the base of the neck. Right arm up, and you go just front and back across the base of the neck, back and forth. And then more to the outside and on the top of the shoulder, and you'll feel like up here, as I said, for a lot of people, this one doesn't feel as thick or hard as the left side. Okay, then around the shoulder blade. All right, now we're going to work on the hips. Okay, so you take the ball on the left side, lift the hip up a little, and then straighten the leg and tilt the pelvis up on top of the ball. And it will sink in. There's like a valley between your femur, your upper leg bone, and the gluteal muscles, so you can work into that socket of the hip a bit. We're going to now carve out your glutes here. So you go down and follow the pathway down around close toward the tailbone. And then on the back, so there's the glutes in the middle, and then, or sorry, in the back of your hip. And then right down the middle, like at the base of the spine, is the sacrum. So if you move the ball toward the side, you'll feel you hit this bony edge, so that's your sacrum. And if you go up along the edge of your sacrum, that will help release tightness in the piriformis muscle, which is often a significant contributor to sciatica. Okay, and when you go up a little vertically here, then you'll hit the edge of your pelvis, the iliac crest, and work out horizontally along the edge of that hip bone. And that's where your glute tendons attach the muscle to your pelvis. All right, so now we'll switch to the other side. So on the right side, the hip up a bit, then straighten the right leg, lift the hips up so you're tilted on top of the ball in the socket of your hip joint. You'll feel the edge of your femur bone, the leg bone. And then we'll work our way down along the edge of the femur towards the tailbone. Okay, and then now if you're more on your back, and if you start going up vertically, I know it's a bit awkward, but it's a really good way to get into these tissues. And then your body weight will sink in right at the edge of the sacrum bone. Then up vertically along the sacrum edge to release your piriformis. And then if you turn toward the right along the lower edge or the edge of the pelvic bone, the iliac crest. On the outside of the hip, for most people, it'll be quite tight. And then if you could turn on the side a little more. And of course, just minimize the pressure according to how your hips are feeling. Okay, so from here, we're going to do something a little different if we could. So we'll come up on like this, hands and knees. And take the foam roller if you have, or if you don't, you can sit in a chair and just roll out your quads. But the foam roller, we're going to start right leg just above the knee. And just gradually, incrementally massage up the front of the leg. Now you can spend all day, working on soft tissue, but we do need to strengthen and just rebuild our constitution. So as I said today, really we're building a foundation, a strong foundation in front of the hip. And we'll switch to the left leg. So just above the knee. And you can rotate your leg and in and out a bit. Try to get all different aspects of the front of that leg. Okay, and when you get to the top of the hip, then the front of the hip, and then on the outside of the hip into the tensor fascia lata. All right, so next we're going to work on the hips a little more thoroughly. So if you could take the right, go left leg forward first like this, so left leg forward. So you're in like this in 90-degree angles, okay? Make sure your hips are square forward and you engage your glutes. So the back leg, we're going to work on releasing the quads, but here your lower back, as we hinge forward, so you want to engage your right leg glutes, be upright, and hinge forward at the hip. So make sure your lower back should not arch, okay? When your quads are tight, the lower back will hyperextend. So your hips are square forward, lower back, you're bracing your abs and lower back. And then you can just slightly rock forward and back into the front of that hip. Okay, and now we're going to turn, slight direction, slight rotation toward the front leg, and again, continue a bit of rocking action. And always be sure that you're not allowing the lower back to arch. Okay, and then come back up to middle and turn away from the front leg. Keep the front leg, the knee in the direction of the toes. Okay, and then we'll switch directions. Bring the other leg forward. Okay, so start this one, knee over hip, or so knee over ankle. Hips are square forward, these glutes engaged. Brace your abs and lower back and slight hinge forward. And if you feel really tight, like here in your quads, I mean, you can do this regularly. And now we're going to turn slightly toward the front leg. Make sure that knee still stays in the direction of the toes. Okay, center. Now we're going to turn toward the back leg side and slight hinging action. Okay. So we're going to continue here with the adductors a little more and the psoas. So we're going to next, similar concept for hip mobility, but the angle is like this, the leg is to the side. So here what the parameters are, your hips should be square forward. When you bring the leg out, you might have to be this angle, like it might not be directly out with the knee. The toes and the knee must be pointing the same direction, and the hips square. So if the hips are square, you'll get a gauge as to where you can plant your leg. And when we rock out, keep the knee back and hips square forward. And then as you rock to the side, you'll feel this here in the psoas muscle and your adductors. Just be sure that you're not twisting. And this knee, often people have the toes back too far. The knee and the toes should be pointing same direction. This knee shouldn't be going in. If it is, you have to adjust your foot. Okay, now let's do the other side. Okay, so first square the hips. And when your hips are square forward, you'll be able to gauge where you can set this leg. I like to have the hand there to remind you to keep the knee back. We'll just rock in and out a few times. Keeping the hips always facing forward and think knee back. Okay. And now for the glutes, we're going to just try, it's not exactly pigeon, but a bit like that. So you'll take the right leg across the back of the left foot like this. So try to be sure you don't arch your back out. And then keep the hips square forward. And keep your shoulders square forward. So here the objective is to feel a stretch on the outside of that hip. Not necessarily to come down into the pigeon, okay? So just keep yourself square to the floor. Make sure you're not twisting your back. But you're helping release the tightness of the femur on the outside of the hip. If you feel it in your groin, then just that those muscles are really tighter and you need to keep doing what we did just a moment ago. Okay, release. And now we're switching to the other leg. So you bring the leg across slightly, bracing your lower back. And keep the hips square forward. Then in the right hip, when you go get into that right hip, keeping the hips square, keep your arms supporting. The focus here is not so much your beautiful position, but that it's accurate. And you're working on keeping the hips square forward and the femur right side is rotating internally in your right hip. So you should feel that stretch on the outside of the right hip. Okay. So we really deliberately are not allowing our backs to hyperextend when we do these. So you're bracing your abs, bracing the lower back. Okay, so that was pretty good prep to attend to the tight hips. Now with the shoulder blades, so reaching up into the trees, harvesting the bananas, and cleaning off the top of your car. So here I have this rolled up towel. It's going to go horizontally, like this across the shoulder blades, like right across that way, across the shoulder blades, not vertically. The arm actions, we'll be doing 3. So first, your arms are like this. You go W to Y. Secondly, the palm of the hand is like this, facing the shoulder, and we'll reach back along the floor. And lastly, we'll hold on to the ball or just imagining you have the ball and reach up overhead. So this helps the thoracic spine to get better rotation of your scapula. All right, so here the towel is horizontally across. Oh, if your neck, right? If your neck is sore or very tight at the back, if your neck is extended, you'll need a little pillow for your head. You don't want to put the head down and go chin up. Your head should be like this, chin toward the throat. All right, from here, the arms, so you might not get them on the floor, that's okay. But where elbows are kind of by the sides like a W angle. Or if you think like the football, right, when they raise their arms up when people score, then elbows are out by the sides. It's like an angel kind of action, arms out to a Y. So the low position looks like a W. And the arms come up like a Y. And you just go back and forth. If you can't get your arms to the floor, that's okay. A lot of people will feel a lot of tension in their biceps or across their chest and the pecs. But that's why we're doing this exercise, obviously. Great. Okay, second, right hand on abdomen, left hand, the palm of your hand is on top of the shoulder. Keep the chin in. And you just slide the arm back along the floor. So the fingertips are in the direction of on the floor, and the palm of your hand is aiming to face down. And that drives your shoulder blade into upward rotation. Okay, and then we'll switch. Right hand, palm is facing the shoulder, and just reach back. This is just a nice mobility drill. And also, people aren't feeling very well. What we just did with our hips and shoulder blades here, it will really help your lymphatic system drainage. That's another really important component of what we're doing today. Okay, so if you have a ball, you can use that. If you don't, usually bring the arms straight up. And I like to also lift the legs up, but keep the chin in. So knees are over hips. And then keep the chin in and reach back. Your arms should stay straight here. So you're driving the action through the shoulder blades, through the thoracic spine, not by bending the elbows and internally rotating the shoulders. We don't want that part. Arms are very stiff, very straight. Okay. And then we'll put those things away. And next we'll quickly go through our regular preparation series with the ball. So again, we'll use the ball. And today, if you could just take the ball in the back of your head and then down along the edge of the skull. So there's a bottom edge of the skull, and you can move the ball along the edge of the skull. You'll have to hold the ball in place. Now, we already did quite a few different exercises, so it probably feels not too bad. Okay, then go along the other side. If we started doing this at the beginning, it would have been quite painful, but this feels really good, actually. And you can also, massage out the back of your neck with the ball. But for now, we're going to move on. And if you could take the strap for the hamstrings, so it's in the right foot. Okay, now we're going to take the leg out toward the right side. But keep your hips flat on the floor. Don't roll over to the side, and keep the chin in. The shoulder also, like left shoulder, is like toward the floor. Don't just roll over to the right. Okay, now we'll bring the leg to the middle. Be careful of hyperextending the knee. Your knee shouldn't bend backwards. And also your lower back should not flatten totally to the floor. Make sure you keep your slight arch in the lower back. Then we'll bring the leg across toward the left side. Now, right hip stays on the floor. Don't let that hip come up. Again, you'll feel that on the outside of your right hip. Okay, and now left leg. Okay, so just be sure you can have your legs straight but not locked. So first we'll bring the leg to the left, keeping the hips flat on the floor, shoulders on the floor. It's not better to rotate your pelvis up. That twists your lower back. Okay, leg middle. Foot is flexed. And your lower back, make sure you're not trying to tilt the pelvis. You want neutral spine, bit of arch. And a leg across toward the right, keeping the hips on the floor. So our aim is to maintain the integrity of the spine all the time. Not over twisting and not flexing and extending. Okay, and we'll put that strap away. And next, the root stick. So the right leg is knee over hip. The left leg is on the other side of the stick. So with the hamstrings, right leg, you're pushing away from you. And you have contact in the quads of the left leg, and you're pulling toward you. If your hip flexors and your quads are been overworked, then you'll really feel it in front of the left hip here. Okay, switch legs. And just pressing the legs with straight arms here. Okay, and we'll put the broomstick down. And now to further open up the chest, we'll just reach out in a Y angle with the arms. And you'll notice if you've been doing this regularly, from what we've done in preparation, it probably feels better than it normally would. Okay, and now we're imagining a stability ball on your abdomen, and we're just going to rock side to side. And here, your abs. If your abs are not sufficiently strong, your back will start again hyperextending, arching. So you can always just hold the middle position. Okay, and then just rest for a moment. Okay, so for abdominal activation, we'll bring the arms up to the sky and bend the elbows 90 degrees. And legs, knees over hips. Lower back again, a bit of an arch. Right leg push away from you just a few inches and hold. Should feel your abs. And then left leg. And then right leg. And left. Okay. And now for the spine rotation. Okay, so we're going to lie on the right side. Left leg goes forward. Left hand reach back toward the right foot. And right hand toward the left knee. So some people, you may not get your back foot. That's okay. But just splay the legs and arms this way. And if you've been doing a lot of snow shoveling, your quads are probably really tight. So today you'll feel it more in the quads. Okay, now we'll turn on to the left. And if you've been shoveling snow or golfing or something, and so now we're lying left side. Right hand reach back toward the left foot and left hand on the right knee. Bring the right shoulder back, right knee forward, and make sure they're both the same heights from the floor, not just rolling the right knee forward. So if you've been like turning a lot in one direction, like playing golf in one direction, shoveling snow in one direction, when you do this exercise, it'll feel quite different on the two sides. But when we do it weekly, it'll help prevent you from over-rotation. Rest, or even daily, the things we do, these sessions you can do every day of the week now. All right. So now I'm going to work on the back here. And if you have, I'm going to demonstrate a couple of different options. It would be best to have something like an Ottawa. Stability balls are good. I thought a lot of people, they're just too unstable, and so it wobbles around too much, which is part of the challenge, but then again, you never actually get a good position. So I like Ottawa. And first is, we're going to do a torso lift, and we're going to hold twice for 15 seconds. Importantly, it should be supported, like your hips are supported here, and you don't want to go way down, hands at lower back. And you just hinge down a little because you don't want to flex your spine. And then as you hold, as you lift up and hold, be sure that you're bracing your abs and glutes and lower back. So your lower back should not be spasming and cramping. And then you just release a little. And again, just lift up and hold. Now, if you don't have that option, Instead, we're going to just break down bird dog. So the other option is like this. You just lift one arm and hold. And then we'll lift the other arm and hold. Okay, so if you could set up whatever you have, if you have your Ottoman, or if you want to do the bird dog. So bird dog group is right arm lift. Ottoman group, legs are straight. Everybody glutes engaged. Everybody chin is tucked in. Lift and hold. Release. Lift and hold. And release. Okay. So next, the bird dog people, you'll just do one leg, and we're going to start with left leg. So it would be the same concept. Brace your lower back. Left leg slide back, straight leg lift. And then we'll do right leg. Without hyperextending low back. Okay, if you have the Ottoman, a little different. In the Ottoman, we'll do 2 leg lifting. Of course, here the air is also very dry from all our heaters. Okay, bird dog is left leg lifting. Other group. When you lift the legs, make sure you brace your lower back, so your lower back shouldn't be arching. Everybody glutes engaged, bird dog, left leg lift. Other group, both legs lift and hold. And down. Bird dog, right leg lift. Other group, both legs lift. And rest. Okay, and the next part, so we're doing all different angles of the spine here, and you may not, we're only going to have time to go through this once, but on your own, you could go through this cycle 2, 3, 4 times. Okay, so next is a push-up type, and it's really great for core where you're like that on the fists. If you can't do fists, you can go like this on the elbows. But for this one, not hands like that. We'll do that another time. So you're on the fist, and what you'll notice is, oh yeah, and should be elevated surface. So rather than floor, if you do it on the floor, your shoulder blades will lift up a bit. You'll feel it in the upper traps. Here we're trying to avoid upper trap recruitment. So just hold position either on the elbows or on the fists. You can use the surface of a chair, but keep the shoulders down from the ears, and you should really feel your abs working. And also gives great support for your shoulder joint. Okay, rest. Okay, we're going to do that again one time. Twist our elbows. Shoulders down from the ears and press. So you get your abs working and shoulders. Making sure not to arch the lower back. Okay, so now back to, this is for the shoulders and for the rotation of the spine. So it's similar to a side bridge, like that. The angle is like this, the elbow by the side, and then if you start like this, elbow by the side, externally rotate. So you start out with no tension on the band and then step back a bit, or you can just bring the arm out in that angle. Okay, so we'll start with, I'm starting with left hand. So at the elbow by the side, and you externally rotate. So you want the hand to go back. And then keeping the elbow by the side and keeping the arm in that position, you step back to get tension. And we're just holding here. Okay, you should feel this, and you might have to consciously do it in the serratus muscle that's on the side ribs. Then step forward, switch right hand, elbows by the side. And as you step back, don't be careful, don't pull the wrist back, but think of keeping the elbow here, but pull the forearm back to externally rotate the shoulder. And again, you should feel it on the side, under the armpit, on the side of the ribs. And release. Okay, so that worked all different angles of the spine. So next we'll work on the deadlifts. And you'll notice after going through all of that, that you'll just feel much stronger and more stable, you know, like the trunk of a tree, as opposed to the branches that get swayed in the wind. All right, so deadlifts, and again for the hips, to make sure we get all the different angles, we're going to do a number of different sets with different positions. With regards to lifting, so when we're hinging like this, you should have this like neutral spine angle. If you round and lift snow, that really hurts the lower back and herniates discs. So the action here is our hip hinging. The feet are just a little wider than hips. Okay, we'll do a set of 20 in this angle. If you could, before we start out, just connect with your feet, heels, outside of foot, and all the toes. Feel them and lift the arch a bit, keeping the big toe on the floor. All right, here we go. Chin is tucked in. Brace your abs, brace the lower back. Hip hinge, and think of pressing the feet into the floor. Okay, and rest. And then just walking around. Okay, for the next two sets, we'll be doing 15 reps. But the legs are wider and single arm. So this is similar to a rotation when you're reaching gardening, when you're reaching over the car for the snow. Left hand holds onto the weight and the palm should be facing forward. So you want to externally rotate the shoulder, chin in, hip hinge, and here make sure that your body stays in the center, that you don't lean to the left or right. Okay, rest. And right from here, right hand, externally rotate, palm is facing forward, hip hinge, keeping the body centered. Okay, and rest. Perfect, and just walking around. Okay, this will help build up your bone density and muscle tone. So last set, we'll take again a narrow stance as we did very first set. Both hands hold on, chin in, and hip hinge. Make sure you're using the glutes. Be careful of using too much of the quads. You have to think hip hinge, squeeze the glutes together. And rest. All right, good. And now we'll put that weight down. And again, just a bit of walking for recovery time. Okay, now again, going back to the gardening and everything, and the snow, the shoulders, right? So we're shoving, everybody's walking around like this, and the coats around, and so everybody's like this. So we already worked on releasing the pecs. So what we want to do is drive a better upward rotation of the scapula. So this time you need just a very light weight, like 2 pounds or 3 pounds. And we'll do 3 sets of 10. So very lightweight, dumbbell is great, or a small kettlebell, 5 pound. So the action is, now this is the critical component, when you're upwardly rotating your shoulder blade, so it's like this, the shoulder blade wraps under the armpit and this muscle is relaxed, okay? If you elevate the shoulder blade, that means the shoulder blade goes up, then it goes like that. And you see, you can't actually straighten the arm. So if you can think, every repetition, shoulder down, shoulder blade comes under your armpit like that, and keep the elbow straight. Those 3 actions will help to repair, like if you've got damaged tissues, that action will help you to prevent from continually overstraining tissues because of bad angles. We're starting with the left arm. Feet are just side by side. The action is the arm comes slightly over toward the right to the opposite leg. And when you lift, it comes up on a diagonal, okay? It's not to the side. And it's also not a lateral raise. It's not like this. It's front and up on a diagonal. So it's like a half circle on that diagonal, which is the rotation of your shoulder blade. Okay, so we're starting with left arm. That's like elbow stays straight. And the shoulders down from the ear. If you can't get the arm all the way up, that's okay. You know, a lot of people have restrictions in their rotator cuff. Okay, switch, right hand. Okay, so now we're going to challenge the hips a little more. So we're going to do a lunge position. Right leg is forward, left leg back. Left foot, the toes should be pointing forward. Left heel up. Left knee's bent. Front leg, toes forward, knee over ankle. Now, the glutes, front leg. So you shouldn't feel it in the quads. You should feel it in the glutes of the front leg. That's right leg glutes, left arm lift. Right leg glutes, left arm lift. Okay, step forward without twisting the knee. That was perfect. Okay, then it's the other side. Left leg is forward, right leg back, toes are forward, back heel is up, knee bent. So here it's left glutes, not the quads, glutes. Right arm lift. Left glutes, front leg glutes, right arm lift. Okay, then step forward. All right. So with regards to the knees, that these kind of forces will help you to be stable with the knees, but you have to be aware of that. So now this time, this knee, we're going to lift across on this way. Be careful, don't let the knee go in. Left leg is forward, right leg is back. Left arm lift, left arm lift. Left glutes, make sure, left glutes, not your right leg. Step forward. Okay, that was excellent. Okay, the other side, right leg is forward. Left leg back. Okay, so here you think right glutes engaged, right arm lift. Okay, now when you step forward, step directly forward, again, and without twisting the knee. Okay, that was great. Okay, so next we're going to do a single leg stance. And because of the back issues that I mentioned, and people are quite unstable, and so we want to stabilize our leg in our hip joints properly. So when if you're slipping and sliding, you'll be staying on your feet. So we're going to use one kettlebell again, or one dumbbell. Heavier is better than lighter. And some days we do repetitions. That means you do like lift, 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 lift. This time we're just going to do one hold. And we'll hold it for 30 seconds. We're starting with left side. Left leg is going to support. Right hand has the weight. Okay, right foot will be off the floor. So the options are you just lift the foot and hold, or you do a hip hinge and hold. And stand. Okay. Then right foot. So you can imagine how these forces will help for the spinal stabilization. Left hand has the weight. Right foot will be supporting. Left foot up. Stay here. Or hip hinge. And hold. Keep the hips level. Be careful of tipping the left hip up. And stand. Okay, and down. And I love doing that for balance, the connection from your foot to your hip, but really good for strengthening the glutes and for building the bone density in your hip joints. Okay, so next we're going to do a superset. So that was set exercise 1. Exercise 2 is a diagonal pull down. So we just did diagonal pulling up, lifting up. Now we're going to do pulling down with one arm. Often we do this with 2 arms. We do that on other occasions. So I have a band. It's attached up high. You can see it's band. If you don't have a band, you can just move your arm through the same pattern. The pattern is just the kind of opposite to what we just did, but more the intention is that you're pulling down as opposed to what we did was lifting up. So I'm starting here with the right side to the band. you have your athletic stance. The left hand has the band. And ideally it's high, just whatever you have is fine. But you go right glutes engage and pull left shoulder blade. Right glutes, left shoulder blade. Okay, now another component of this action is rotation of this rotator cuff. So as you're pulling, okay, you're pulling like this, you're also externally rotating. So at the bottom, your hand is facing forward, not like this, okay? So if there's a rotational component, you're up here and then you pull at the bottom, the palm is facing forward. Okay, so now we're going to do we'll do a set of 10. Left arm, high right, and then pull down low left. External rotation as you pull. Okay, and then we'll turn around. Okay, so it's high left, the right hand is pulling. High left, low to the right, externally rotate as you pull. Rotate the shoulder blade out. Left hip, you should feel left glutes, right shoulder blade. Left glutes, right shoulder blade, not right leg. Okay, rest. Perfect. So now we're going back to the hip hinge hold. So you see these two exercises work diagonal, opposite hand to opposite hip. So left leg is supporting, right hand has the weight, right foot up, hold, or hip hinge. And carefully stand. You should feel this mostly in the hip of the supportive leg. Okay, now right leg supporting. Left hand has the weight. Chin tucked in. Left foot up and hold, or hip hinge hold, keeping the hips square to the floor. So you might have to rotate the left hip down. Carefully stand. Okay, great. And then back to the band. So this time we're going to do a lunge as well. We're going right side to the band, right foot forward, left leg back. Left hand is pulling, right glutes engage, left arm pull. And then switch sides. So left side to the band, left leg back, left foot forward, right leg back. And so we're pulling, right hand is pulling, high right, high left, low right. You should feel left glutes here and right shoulder blade. And then rest. Okay, so that was for helping our spine. All these different diagonals to help to hold the spinal column aligned vertically. Hope that helps you out. Have a great week. Here we're getting ready for another ice storm. Thank you.